Let's move on. Next page. Section 4, very important. Other insurance. This is a fishing question. Okay, they're asking this question for a reason. All right, and what they're trying to ask is, do we need to put a pre-existing condition on you? That's what they're asking, really. So I'll just read it to you. Have you or any other of your dependents had any other health coverage in the last 6 months? If you haven't had a health plan for the last 6 months, they can put a pre-existing condition on you, which means they'll cover everything except the condition you have right now. So it's very important that you've had coverage for the past 6 months and you note it here. Okay, so you mark yes if you've had previous coverage. And really this is from September 1st back 6 months. So March 1st to September 1st. Okay? That's really, you need coverage before March 1st for no pre-existing conditions. So you put yourself here and then your spouse. Just click medical for each one, because it doesn't apply to anything else. Your carrier right now, is it Blue Cross Blue Shield? So just put BCBS to shorten it. Start date is when you basically started employment. You can put 11/22?
Well, it's 12/22 is actually the same date as well.
12/22 of 09. 12/22 of 09. Yeah, that would be a good one. It's definitely before March, so you're safe. And then the end date for everyone is going to be 8/31 of 2010. Your policy ends on 8/31 of 2010, and all these new policies begin on 9/1 of 2010. Did I ask you to put your social security number on the top of this app yet? Would you please? So give everybody time just to fill that out. That way, what happens is they have a red flag in their system that says if you don't have coverage past 6 months, they red flag, and if a health condition comes in, they'll send you a letter saying, listen, you need to prove you've had prior group health insurance. I don't think it'll be a problem for most people. If you haven't had coverage for the last 6 months, just see me after, and we can work through trying to see what we can do. Because there's different stipulations on that. It's not as generic as just the last 6 months. It's continuous coverage with no more gap than 63 days and yada yada. So I'll go through your specific example.
What was the end date? 8/31.
Okay, the next section is 5, Medicare coverage. It doesn't apply to anybody in this room, I don't think. If it does, come see me after, but nobody's on Medicare here, I don't believe. Section 6, waiver of insurance. If you want to waive the plan, you'll just check this box. You don't have to take the medical insurance. And you just give a reason. Otherwise, don't check it if you want the coverage. Question 7, this is part of what I said before. It's just an older application. It doesn't apply anymore. But it gives me a good opportunity to explain something that healthcare reform came out. Healthcare reform now requires us, in fact, technically we weren't required, but we decided to do it anyway because it's going to be the law anyway soon. Healthcare reform requires us now to allow any employee to cover their dependents on your plan through age 26, no full-time status needed, no other qualifications. It doesn't matter. Your dependent child who's age 26 can come onto this plan, and they can have a spouse and their own family not living with you. You don't claim them on your taxes. It doesn't matter. You can put your dependent on this plan up to age 26. The only stipulation in the law, and there's minor verbiage in the law right now, they're still trying to clarify a lot of this, is that they can't have access to another group plan. But who's going to really prove that? I mean, we don't ask everybody whether their dependent has another group plan. So really, it's through age 26, period. You can add them to the plan, no questions asked, no full-time student status needed anymore. Okay? Section 8, most important thing on the app to us, because we can do a lot of things. If you call us and you miss something on the app, or you say, you know what, Darren, I want to use a different address, or you know what, I had a date of birth wrong, can you correct that for me? We can do a lot of that for you, but we can't sign it for you. So we have to hunt you back down if you don't sign it. So please sign this app. Today's date is 7/28/2010. Sign and date, 7/28 of 2010. Okay, that is one app down, 2 mandatory apps to go. Next app, up on the board, in my hand, on the top left-hand corner, it says Transamerica. On the top right-hand corner, it's TransConnect Employee Enrollment Form. Just to explain briefly what this is, it's another medical plan. So we have a supplemental medical plan for the Anthem. You can't have this coverage without a major medical plan, so it kind of ties into the medical plan and makes one medical plan, a better medical plan. Okay? So it's just another medical plan. If you have the Anthem, you have to have this. It just goes with it. Okay? So Transamerica, first application is checked for you. Company name's filled out for you. Over on the right where it says location, if everybody could just circle Nevada. And then employee, last name, first name, middle initial, the same thing you're filling out on all these apps. Again, don't put your spouse on this application if you're not adding your spouse to the plan. Date of hire is the date you were promoted. Average hours worked per week could be 40, it's fine. We don't need a salary on this application. Go ahead and put your occupation, and we don't have an employee ID. Home address, again, make it legible so your ID card will arrive. Home phones are not required. You don't need your work phone or your home phone. The only reason why I would put those is because let's say you were on the phone with the insurance company trying to work something out. Let's say they dropped your call. They'll know where to call you back because they have you in the system. If they don't have a phone number for you, they can't call you back. And then you have to start all over with someone else. How many people have done that? You like spend a half an hour on the phone with somebody and then you got to call back and start all over. So at least they'll know where to call you back if you have a phone number in their database. They're not going to telemarket you. I haven't seen that happen, and if they do, you please email me so I can put an end to that. Children go here, date of birth, gender. Don't worry about the full-time student, doesn't apply anymore. We're not putting down beneficiaries on this app. So the beneficiaries don't apply. And we're almost through with this app, and it's not a very complicated one. Next, underneath beneficiaries, we filled in the payroll mode for you already. You will need to mark who you're applying for. Right here in the middle of the app, employee plus spouse, plus child or family. Like I said, if you need to come back to this, that's fine. But just red flag it so you can come back at the end of the meeting after you know how much it costs. But you'll need to check one of those boxes. We filled out these 2 questions for you, assuming that those are going to be the answers. I can't imagine that they wouldn't. Do all proposed insurers participate in the employer's major medical plan? Yes, you're here. You're going to be an Anthem. If you're not, you won't take this coverage either. Is anyone proposed for coverage under Medicaid? Well, no, because it sounds like you're going to be on the Anthem benefits if you're filling out these forms. So, no. So we filled those out for you. I don't want you to know what you're signing. On the very bottom, signature. Most important. They give you a funky way to do the date, but it's just the way their legal department does it. This 28th day of July/2010. This 28 right here, day of July 2010. 2 outs down, 1 to go. 1 mandatory to go. All right. Guardian application is next. It's all in order for you. Guardian application, just so you know what you're filling out here, it's important to know what you're filling out before you fill it out, is dental. Have a new dental plan that's better. Vision plan now. A life insurance through Guardian. We have short-term and long-term disability now through Guardian. And we have a voluntary life insurance that you can apply for. If you want more life insurance on your own, then you pay for it. But we get a group rate on it. So for all the employees, it's probably a better rate that you can get just on your own. Okay, we'll start with about yourself underneath the Guardian logo, and then the employer use only, and then it says about yourself. Again, same trend. Fill out this first name, middle name, last name here, the way their format is. First name first. Gender, date of birth, social security number, address. You don't have to put your email address or phone numbers on there if you don't want to. Although I encourage it. Oh, another reason why you want to put your email in the app, so we can get a hold of you. So if we need to track you down and get something from you, then we'll have your email address too. Otherwise, we could always ask Kim. Okay, underneath that, we need your job title on here. We need your full-time work status. We need that date of work status began as your full-time hire date or date of promotion. And then we do need the annual salary on the application. This one, because it's tied to short-term disability and long-term disability, we need to know how much to pay. It's all confidential. We don't show anybody, or we keep it very close to our vest, but we do need that on this app. Because if you're out on a disability claim, they're going to ask us what was the earnings, and then they're going to verify it with Kim, and then they're going to pay you a benefit. So if you feel like filling it out at the end, I understand you can do that, but I do need it. Are you married? Do you have children? About your dependents. Same thing, same trend, spouse, child, add, gender, date of birth, social security number for the spouse, date of marriage for the spouse. Don't need any full-time students. Question.